Thank you for the invitation. Today, I'm going to talk about development of fast-acting antidepressant based on a nuclear receptor-mediated innate immune mechanism. For some reason, it's not okay. As you know, there are about 3 million people with MDD in the world, and the existing antidepressants are only effective in half of the patients with MDD. Our group is interested in developing novel antidepressants from single molecules isolated from the herb. Currently, the neuroimmune balance as a mechanism for the antidepressant drugs is quite popular. It is because that the most consistent clinical findings in patients is the enhanced inflammatory factors in the plasma, like CRP, TNF alpha, IL-1 beta, or IL-6. If you look at the detailed mechanism that people propose, that danger-associated molecular patterns or microbial-associated molecular patterns, they are activated some dangerous signals like LPS, the exogenous ATP, and activate the formation of inflammation. And the inflammation will cause the formation of active caspase-1 and leads to the production of IL-1 beta, or the inhibition of the synapse, the excitatory synaptic function. The mitochondria also contributes to the pathophysiology of MDD, because if you see the mitochondria in depression, in depressed patients, you can find the the mutation of mitochondrial DNA, the NROS, and swollen mitochondria. This sick mitochondria will leads to the assembly of inflammation, again to activate the formation of cytokines or the inhibition of the synaptic function. Dr. Ron Duman has published a paper a couple years ago in Molecular Psychiatry that he emphasized GLU-A1 synaptic function as a convergent mechanism for the rapid acting antidepressant effect. With the background I've told you, why nuclear receptors? Nuclear receptors such as GR, MR, AHR, PIPA, gamma, etc., they all are known to modulate the inflammation activity and subsequently depression-associated behaviors. So we have to look at this disease and the drug mechanism from an endocrine perspective to understand the role of activation of nuclear receptors. First of all, let's look at the famous ketamine, ketamine, Dr. John Crystal, Dr. Carlos Zarate, and Gangwan, and many scientists have approved that it is clinically effective, fast-acting antidepressant. And recently, people found that the ketamine will cause the increase of kynurenine and kynurenic acid, KY and KYNA, and then activates the nuclear receptor AHR to exert its function. If we have a closer look, and you can see this is the tryptophan pathway, and with the inflammation, the tryptophan, instead of changing to 5-HT, it changed to kynurenine or kynureninic acid to binding to AHR, and then inhibits the assembly of inflammation, and then subsequently inhibit the formation of inflammatory cytokines, and also enhance the AMPA receptor function. The other example is GR. Everybody knows that Cushing syndrome or Addison syndrome, once you cut off the tumor, the mood is like drastically changed. So the most consistent biological findings in MDD patients are the elevation of plasma cortisol, and also the change of HPA axis. Why is that? If you look at the closer mechanism, me and Husseini Manji, we published a paper in PNS a couple of years ago that we found that, the GR can change mitochondrial function immediately. It enhances the mitochondrial function in acute treatment, and the inflammation is inhibited, and you can see an enhancement of excitatory synaptic function. However, after chronic massive glucocorticoid elevation, the receptor and its chaperone protein like FKBP51, BAG1, etc., they are exhausted, and then you can see a decreased mitochondrial function, and inflammation is activated, and also decreased excitatory synaptic function. This is probably the mechanism. The other example is vitamin D, which is also known to has a clinical benefits to patients with depression. And if you look at the function of vitamin D, you can see also through VDR, it can inhibit the inflammation, and then exerts its function on behavior. As ER as well, the estradiol also can enhance mitochondrial function and regulates synaptic transmission. And if you have a close look, and this is a premenopause, normal levels of circulating estrogen, and go through its receptor ER beta, it can inhibit the formation of inflammation, and inhibits the formation of cytokines as well. While during the perimenopause, the reduction of estrogen will lead to the activation of inflammation. So make a summary of the story. I've just told you that the kynurenine, kynureninic acid, cortisol, estradiol, vitamin D, etc., go through their nuclear receptors. They will inhibit the formation of inflammation, and then enhance the AMPA receptor, and the reduction of the pro-inflammation cytokines. Back to our story of Chinese herbs. The Chinese herb monomers are often similar to micromobile derived metabolites, for example, the thing we were just talking about, the tryptophan pathway, and the other pathway it involved is the bile acid pathway. The bile acid usually they are synthesized in the liver, and with the help of bacteria, it becomes a deconjugated forms. Deconjugated forms will go through the systemic circulation and regulates the brain function. Let's have a look if chain audio deoxycholic acid, CDCA, if it has an antidepressant effect. This is unpublished data from our lab, and we found that, with after injection of CDCA and 60 minutes, it demonstrated antidepressant effect in TST, tail suspension test. And we, after 5 days, also demonstrated antidepressant effect in for swim test. And the specific inhibitor of FXR, GS, can abolish the antidepressant effect of CDCA. And if we also established the CSDS, the chronic social defeat stress animal model, and the CDCA also shows an antidepressant effect. We isolated the prefrontal cortex and look at the inflammation activity. In the CSDS, you can see the FXR is reduced, its receptor is reduced, and activation of inflammation by increasing pro-caspase-1, pro-IL-1 beta, and the IL-1 beta. And also the AMPA receptor is expression is inhibited. And after we use the CDCA, you can see a rescue of all this AMPA receptor function. So make a summary of the story that, CDCA, they pass blood-brain barrier, get into the brain, and then activates the receptor FXR and inhibits the assembly of inflammation and, enhance the synaptic AMPA. So can we use this mechanism to develop new drugs? And we found that ganaduric acid is can rescue the inflammation and depression. Ganaduric acid is isolated from Ganoderma lucidum, a famous drug, Lingzhi, or Yunzhi from Japan. And it has many pharmacological effects for anti-tumor and anti-inflammatory effect. And as you know, the farnesoid X receptor FSR is the bile acid receptor, is a CDCA receptor. So first of all, so this is the GAA, the ganaduric acid. And when we inject it to the animals, it does shows the antidepressant effect. And in the open field test, it doesn't show any hyperactivity. After, we did a molecular docking, and we can see that GAA can perfectly binding to FXR. And we also established CSDS, which is a depression model, and we found that the GAA also shows antidepressant effect. We also found that GAA can inhibit the inflammation activity by look at the caspase-1 production and IL-1 beta production. We also look at the AMPA receptor function, and we found that, in CSDS depression model, you can see a reduction, and the GAA treatment rescued the CSDS model of depression. Make a summary of the story. GAA, ganaduric acid, is a single molecule from the herb, shows a rapid antidepressant effect in CSDS model, tail suspension test, and for swim test. Secondly, GAA directly inhibits the activity of inflammation, and also enhance the phosphorylation and expression of AMPA receptor GLU-A1. FXR expression is decreased in CSDS depression mouse model, and using this FXR specific inhibitor GS will demonstrate an will abolish the antidepressant effect of GAA. We also look at the other oridanan, which is another bioactive component, and we found that it may have an antidepressant effect through the pipa gamma. So first of all, the injection of this molecule shows an antidepressant effect. And we found that the pipa gamma is enhanced by the treatment. And also the GW, which is a pipa gamma specific inhibitor, will abolish the effect of oridanan. And the oridanan also modulate the AMPA receptor levels by enhancing the AMPA PGLR, PGLU-A1 and GLU-A1, and GLUR2/3 is also increased after 5 days of treatment. When we use the GAIKI, which is an AMPA receptor specific inhibitor, and it can abolish the effect of oridanan. Therefore, we found that the oridanan mediated through pipa gamma, and then glutamate AMPA receptor then exerts an antidepressant effect. Make a summary of the story I've just told you, that the oridanan have a pipa gamma, went through pipa gamma can inhibit the inflammation activity, then have an antidepressant-like effect. So does CDCA or GAA, they mediated through FXR, also can inhibit the inflammation activity, and then enhance AMPA and shows the antidepressant effect. And thank you very much. I would like to thank my colleagues in Anding Hospital, in Capital Medical University. Those are my PhD students, and also the master degree students. And also thanks the my team in Yunnan University, especially Li Haoran Li and Hongkun Bao, who have done the GAA work, and Ping Liu, who has done the oridanan work. Thank you.